The next type of pneumonia that we're looking at is the community acquired pneumonia. We said there's a type of pneumonia that is from the ventilator, right? Then there's a type of pneumonia that is from the hospital or nosocomial acquired. So this one now is like community. It's just a type of pneumonia that you actually just got it from the community. All right, probably due to contact with infected individuals or something. All right, so let's look at the community acquired pneumonia. So this is pneumonia, which is a disease condition that will affect the lungs, right? Like there will be fluid in the alveoli, so now you'll not be able to now breathe the way you want to breathe. Okay, so that's usually the problem. So a simple definition of community acquired pneumonia is simply what? Infection of the pulmonary parenchyma, and this is acquired due to what? Exposure from the community. So if you got pneumonia from the hospital, we say this one is what? Hospital acquired or nosocomial. If you got pneumonia from due to ventilator, you could say that this one is ventilator acquired pneumonia, but this one is community acquired. So you actually got this disease condition from the community. All right. So it is classically divided into the typical and the atypical syndromes, right? For the typical community acquired pneumonia, let's have it. This one presents into a typical or severe acute infection. All right, this one is very, very typical. All right, we have seen a lecture where we have spoken about the symptoms of pneumonia and all that. So this one is very, very typical. All right, and anything that is typical, definitely you know that the organisms causing it are also crazy guys, right? So you have the S pneumoniae and the H flu are the major organisms that so call this. Okay, so these ones, they can be culturable and they can be identifiable. So when you do a test in the hospital, you can be able to now culture them and even identify them. Okay, so and they are also responsive to cell wall active antibodies. All right, so these ones, they are responsive to that. They're going to the atypical one. This one is atypical, so it's not looking typical. All right, so it presents with usually subacute symptoms and all that. All right, causative pathogens are difficult to culture. It is subacute, it's not really obvious. So even to now, how will I say it? Even to trap the organisms is hard, okay, because it's atypical. So they are difficult to culture and identify by standard methods, and they are not responsive to penicillin antibodies. All right. So if you take a history, like let me say for typical community acquired pneumonia, if you take a history from the patient, typically they would say that they were previously healthy with just a sudden onset of fever and shortness of breath. Okay, so just know that the typical one presents with acute fever features, right? So other physical signs and symptoms include they'll be having fever, tachycardia, tachypnea. They'll be having a productive cough with purulent sputum, and possibly they might be coughing with blood. That's what Haemophilus. The patient can be pale or cyanosed. All right. Then if you percuss, you feel a dullness, right? There'll be decreased breath sounds. All right. There'll be crackles, bronchi, or egophony. That's E to A change. All right. Then if you do an investigation, if you do an investigation, if you do a chest X-ray to show lobar consolidation, if you do a complete blood count, it will show elevated white blood cells. That's what leukocytosis. Then sputum sample will contain neutrophils, red blood cells, and gram stain will be positive depending on the organism that is causing the problem. Then for the atypical one, let's take the scenario of a patient that presented and the patient was 32-year old. Okay, so the patient actually had a history of 1 week of low grade fever, He had a sore throat, an intractable cough. There will be minimal sputum production. All right, which one is atypical? The patient will still be able to walk. All right, the symptoms will not be taking them down like that. No sick contacts, no recent travel or evidence of altered immune system. All right, so usually this type of people, their history around the disease condition will not be that clear for you to now know that this is where they actually got it. Okay, so physical examination will reveal a mildly ill appearing patient with diffuse wheezing on lung examination, right? So primary care physician will prescribe empiric antibiotics for community acquired pneumonia with complete resolution. So this one will present with what? A walking pneumonia syndrome. So the patient has a pneumonia, but it's going about doing all their things and all that stuff. All right. So guys, I think this is it about what the community acquired pneumonia. So see you guys pretty soon.